Good afternoon and welcome to the 4th Annual Northeastern Central Pennsylvania Interprofessional Education Coalition Collaborative Care Summit. The goal of this summit is to allow students the opportunity to learn from, about, and with each other. As part of this learning process, we've created a short video to briefly describe how each of these professions contribute to the care of our patients. We hope you enjoy it.
Hi, my name is Alyssa and I'm a senior nursing student at Misericordia University. I want to talk to you a little bit about how nursing works with the interdisciplinary team to provide our clients with a holistic experience. Registered nurses are professionals who provide direct patient care and collaborate with all aspects of the medical team. We assess patients, interpret lab values, determine nursing diagnoses, administer medications, and develop care plans to serve as a guide for the patient's care throughout their illness. We provide a large amount of patient teaching and education, serve as patient advocates, and translate the complex medical world to ensure that the patient understands. You'll find nurses in any healthcare environment you can imagine: doctors' offices, outpatient clinics, and of course the acute care hospital setting. Nurses are also playing an increasing role in the community with preventative care, helping individuals stay well and stay out of the hospital. In all of these settings, we collaborate with the healthcare team to coordinate the patient's journey to wellness through case management. Nurses also participate in research and use evidence-based practice to support their interventions. People are attracted to nursing because of the variety of areas to work in. There is the ability for continuous education and specialization. You could advance from an associate's degree to a bachelor's degree, or go on to become an advanced practice nurse. Nurse practitioners and clinical nurse specialists have the ability to diagnose conditions and prescribe medications. There are always nursing jobs available, and in any role they fulfill, nurses work with the whole healthcare team to help their patients and provide excellent quality of care. I hope this gave you a general overview of what registered nurses do and that you recognize the important role that they play on the healthcare team.
Hello, my name is Becky and I'm representing the first class of physician assistant students at Misericordia University. A physician assistant is a medical professional that is trained to practice medicine in a team setting under the supervision of a physician. This team consists of doctors, nurses, and pharmacists who all work together to provide the best possible care for a patient. Physician assistants provide a pivotal role in the treatment and prevention of illness and injury. This is accomplished through a broad range of medical services, including taking a history, performing a physical exam, diagnostics and treatments, ordering and interpreting lab results, prescribing medications, assisting in surgery, and educating the patient. The areas of practice for the physician assistant are limitless for the 86,000 physician assistants that are currently licensed. Although the practice was initially developed for primary care, only approximately 1/3 of practicing physicians work in this setting. Physician assistants work in hospitals, clinics, and other healthcare facilities. They exercise autonomy in medical decision-making determined under the care of their supervising physician. I chose to be a physician assistant because of the flexibility in the lifestyle, as well as the ability to practice medicine as with a team. I hope that this has given you a better understanding of the abilities and competencies of the physician assistant.
Hi, my name is Lindsay and I'm a medical imaging major at Misericordia University. Medical imaging, or radiology as it is more well known, is a diagnostic department that can serve also as therapeutic at times within the healthcare system. There are many modalities to this profession. These include but are not limited to CT, MRI, nuclear medicine, and radiation therapy. Our main goal as radiologic technologists is to create optimum radiographs that portray in detail the bone, cortical outline, and soft tissue of the area of interest while using the least amount of radiation. As radiographic technologists, we have many key goals and responsibilities with one main goal in mind: to create the best possible image while maintaining patient safety at all times so that the radiologist can make the best interpretation of our work. There are many environments in which technologists can work. These include hospitals, outpatient imaging centers, clinics, research facilities, and commercially with the equipment manufacturers. Many people are interested in this field because at one point in their life they had an imaging procedure done, were fascinated by the profession, and wanted to learn more. Others wanted to take care of patients in this type of setting. Being a radiographic technologist is a rewarding position because we are one of the first lines of care for the patient.
Hello, my name is Katie and I'm an occupational therapy student at Misericordia University. Occupational therapy helps people of all different ages and conditions to become more independent in the things they want and need to do on a daily basis. OT is a client-centered practice, which means the therapist works closely with the client to create and work towards achieving goals. These goals are centered on occupations that the person needs to do each day, such as dressing, bathing, and leisure activities that are especially important to the individual. Occupational therapists also work towards adapting the environment or tasks to help the person regain independence in these areas. Occupational therapists work in a variety of settings for the pediatric, adult, and geriatric populations. These settings include, but are not limited to, early intervention, school-based therapy, inpatient rehabilitation, outpatient rehabilitation, hospitals, and skilled nursing facilities. Depending on which area the OT works depends which role they play on a healthcare team. Very often, occupational therapists work with physical therapists, speech-language pathologists, physicians, and nurses. Many people are drawn to work in the OT profession due to the personal nature with the clients and the reward they get when clients are able to regain independence.
Hi, my name is Tori and I'm a speech-language pathologist student here at Misericordia University. If you've ever watched The King's Speech, you've probably heard of Lionel Logue. He provided services for stuttering for King George VI in the early 1900s. And as early as 1925, our profession has grown and evolved into something that's more comprehensive and client-focused. Speech-language pathologists work in a variety of settings, from home health to rehab, nursing homes, private practice, general hospitals, and school systems. Our clients can be as young as birth to 3 to adults in their final stages of life, and our areas of specialty are just as diverse. Speech-language pathologists, or SLPs, help with articulation, voice, swallowing, language, and cognition. And so there's a lot of flexibility in what we can do and who we can work with. But regardless of what we're doing and who our clients are, I think that we will all agree that we really appreciate collaboration between disciplines. And so you'll often find speech pathologists working with OTs and nurses, teachers, physicians, family members, and even psychologists to implement and create the best course of action for our clients. Speech-language pathologists are often called upon to be advocates, allies, teachers, and counselors for our clients. And we work tremendously hard to provide them with the highest level of care and attention so that they can have the best quality of life and communicate effectively.
Hi everyone, my name is Greg. I'm a third-year physical therapy student here at Misericordia University. So what do physical therapists do? Well, we use movement analysis and interviewing a patient to find out their goals to help patients obtain their maximal functional status and improve their overall quality of life. So we deal with patients all across the lifespan, whether it's infants and children, teenagers, middle-aged adults, all the way up to the elderly. And what we do is we take our functional, task-oriented approach and apply it directly to the patient to help them obtain their goals. So for instance, if we had an athlete come in who sustained an athletic-based injury, we would, through our interview, find out what their goals are and how we could help them get back to that sport. And throughout our treatment, we would put them through sport-specific exercises and tasks so they not only were able to return to that sport, but also return to that sport safely. However, we're not only limited just to working with athletes. Say, for instance, we had a patient who had a stroke. Strokes are very complicated diagnoses to deal with. So what we would do is, through patient education, teach them new ways of doing tasks that they previously did in everyday life activity with just a new twist on it. So this could include weight shifting back and forth in your wheelchair to make sure that you don't get skin breakdown and avoid the occurrence of wounds. Also, we could teach them new ways to get up and out of their chair and walk around in the community just like they had previously, just with a little bit of an adaptation on it. So I know we've only scratched the surface here of what physical therapists actually do, but I hope this gives you a little bit of insight into physical therapy and how we help our patients obtain their goals and improve their maximum functional status.
Hi, my name is John Brady, and I'm in my final year of pharmacy school at Wilkes University. I'm here today to talk to you about the profession of pharmacy. I'd like to explain what pharmacists contribute to the healthcare team and where you can find us practicing. I'd also like to discuss why many of us chose to join one of the most trusted healthcare professions. The most common area of pharmacy practice is the community setting, such as a national chain, neighborhood grocery store, or locally owned independent pharmacy. In the community setting, you can find us counseling patients on medications and providing recommendations on over-the-counter products and supplements. We are the last point of contact between our patients and their medications. Therefore, we take great pride and responsibility in ensuring the safety and efficacy of the medications we dispense. We value our accessibility to patients and encourage them to approach us with questions whenever possible. In addition to providing valuable information to our patients, we work closely with their physicians, tailoring drug regimens to meet each individual's needs. We also offer some unique services, such as diabetic footwear fittings, and we protect public health by administering immunizations. The hospital is another setting where you can find many of us. Hospital pharmacists commonly work as part of an interprofessional team, rounding with physicians and other practitioners, providing evidence-based recommendations regarding the appropriate use of medications. We also help to control costs by managing drug formulary systems. And when our patients are ready to go home, we provide discharge counseling, ensuring that before they leave our care, they are comfortable with and knowledgeable of their medications. An emerging area of pharmacy practice is ambulatory care. Ambulatory care pharmacists practice in primary care centers, such as a doctor's office or clinic, where we collaborate with practitioners to actively manage the treatment of chronic diseases such as diabetes, hypertension, and dyslipidemia. In conclusion, pharmacists are medication experts. We chose the profession of pharmacy because we believe very strongly that by working with other healthcare providers, we can improve outcomes, enhance care, and impact the lives of our patients.
Hello, my name is Timothy Rigotti.
And my name is Aaliyah Cable.
We're paramedic students from Luzerne County Community College. Today we're just going to tell you a little bit about the profession of being a paramedic and how it differs from any other medical profession.
Paramedicine is the first line of defense, you could say, for patients. When someone has a medical emergency or a traumatic emergency, they call 911 and we're the people who come immediately. We begin our treatment with an assessment, find out what's wrong with the patient. We can provide the patient with things such as airway management, IV and fluid therapy, drugs that the patient may need to help them breathe better, to correct problems with their hearts, and even such things as nausea, vomiting, we can help the symptoms with. From there, we can transfer the patient to a hospital or the appropriate facility and transfer care to the doctor.
Paramedics aren't just associated with emergencies. They can also be used in interfacility transports. That's one hospital to another hospital. Or they could work as a technician in an emergency room.
We also can move up in our schooling. We can become nurses and doctors. Several of us strive to become part of Lifelight, whether it be as a Lifelight RN or a Lifelight paramedic.
Hello, my name is Amy Janeski. I'm a third-year student at the Commonwealth Medical College, and the main reason I decided to go to medical school was actually my interest in teaching. I taught for a couple of years, and I wanted to combine my loves of science and medicine along with teaching, so I decided to come to medical school. One of the highlights of this program is that we get to work in inpatient and outpatient settings and actually work with a lot of different professionals. So in a typical week when I go to my pediatrics rotation, I interact in the hospital hospital with nurses and other physicians and case managers. Also on my psych rotation, I've been able to work with students from other universities in PA programs, nurse practitioner programs, and other med schools. I'm also lucky that when I go to a couple of different offices, because our curriculum third year is primarily outpatient based, I'm able to work with people that have been in the field for a really long time. And some of the people that I've learned the most from have been my preceptors, which are attending physicians, and also nurses that have been in the field for a really long time. Finally, the last part of our curriculum entails some afternoon didactic sessions, which are lectures. And we have different professionals come in, not just in medical field, but that come from pharmacy programs, that come from palliative care, and that come from social work. So that's a chance that we get to kind of work as a team while going out and experiencing the day-to-day life of a physician.
Hi, I'm Heather.
I'm Diane.
And we're nutrition and dietetics students at Marywood University. We'd like to share with you what it means to be a registered dietitian. A registered dietitian has the credentials to work in a clinical atmosphere. Here, they use medical nutrition therapy to help treat and prevent diseases such as cardiovascular disease, diabetes, cancer, obesity, and kidney disease. The registered dietitian also ensures that the patients are meeting their recommended nutrient needs while also giving the patient information on how food and disease are related.
Dietitians may work in hospitals, health maintenance organizations, private practices, or other healthcare facilities. Other career paths include community and public health, food service, business, sports nutrition, and corporate wellness. Dietitians provide an individual with the knowledge they need to help take control of a vital part of life, their diet. They build a rapport with the patient or client, encouraging them towards a healthy lifestyle.
Dietitians work alongside other professionals on a day-to-day basis. Collaborating with physicians on appropriate diet orders and communicating with speech-language pathology on safe eating are just a few ways that dietitians are part of an interdisciplinary team.
Food and nutrition have a role in determining a person's health. Dietitians then play a role in promoting health and wellness for all individuals, working alongside other healthcare professionals to facilitate optimal health for patients under our care.
Hello, my name is Melody Collins, and I'm a second-year graduate student in the School of Social Work at Marywood University. I currently am doing my field experience at a medical clinic in Wilkes-Barre, PA, and I'm enjoying working with the underserved and providing healthcare services. I do a lot of one-on-one counseling and group work, and I also help provide prescription assistance and work in an interdisciplinary facility. Playing a germane role in diverse aspects of care, social workers work in a variety of settings. This assists with biopsychosocial spiritual assessments of clients. We need to assess factors that may be potentially influencing our clients, whether positively or negatively. We can then evaluate whether lifestyle changes are necessary for our clients. Social workers are also client advocates. We believe that social workers should promote the well-being of our clients. In doing so, we may provide resource assistance, which may be in the form of transportation, childcare, financial assistance, and sometimes even mental health care services for our clients. Part of our advocacy and assistance may include ongoing psychosocial services to the client and her or his family. Collaboration with other disciplines is key to success, especially in medical social work settings where one may need to collaborate with physicians, nurses, nutritionists, dietitians, and other professionals. This fosters communication among professionals, communication which is vital to providing the best possible services to our clients. Along with discharge planning, which is done in collaboration with our clients and their families, we need to provide other services for our clients. We're not done. Far from it. In fact, further assessment and evaluation are needed to complete the care treatment plan and follow through. As social workers, we are perpetually concerned with the common good, which requires relentless advocacy and empowerment for our clients. As Jane Addams stated,
The good we secure for ourselves is precarious and uncertain until it is secured for all of us and incorporated into our common life.
All healthcare practitioners, including
speech-language pathologists,
radiologic technologists,
occupational therapists,
pharmacists, and therapists, among others, need to understand the importance of communicating.
Working within healthcare teams,
and coordinating our efforts to provide care that is client-centered,
safe,
effective,
efficient, and equitable. Our performance must be guided by high ethical and professional standards. We need to recognize our own limitations, understand each other's roles and responsibilities, and learn to trust each other, our patients, and their families. As a team, we can make a difference.
So students like me,
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 us, and me can make a difference.